All right, and good afternoon. Welcome back. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases right here at Northwestern's Feinberg School of Medicine, who addresses the latest COVID news and answers your COVID questions every Tuesday and Thursday right here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering your questions and addressing the latest COVID headlines through today, the 28th of April. And should you have a question, we welcome you to send it to us. You can email us at globalhealthinstitute@northwestern.edu. And leading the discussion is our student research assistant, Sophie. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Good morning.
Now for some updated COVID statistics. Unfortunately, we are seeing a rise in cases around the United States. Yesterday, the United States saw 84,740 new cases. If you remember, maybe about 2 to 3 weeks ago, I was spewing numbers in the 30s. So we've had a pretty big increase with a 59% increase over the last 14 days, with a 7-day average of 53,432. While hospitalization and deaths are both decreasing, people are still suffering from COVID, so we can't forget that. In Illinois, we had 3,413 cases yesterday, with a 7-day average of 3,136, with a 44% increase over the last 14 days. And hospitalizations have increased in Illinois by 18%. Okay, what can you tell us with these numbers? What Fauci said yesterday? What can you tell us about these statistics?
We're beginning the sixth wave. That's what's happening. Cases are up and they are grossly underreported because there are so many tests out there now that you can buy over the counter and do yourself, make your own diagnosis, speak with your physician that you have symptoms, your home test was positive. These people are not going to a laboratory and getting a molecular test like a PCR. So they don't count in any of these numbers. So you just need to multiply what the numbers you just said by maybe as much as 10. I mean, we don't know how many people are having infection because we just don't know. We just know how many tests are being sold. That doesn't help us. So the numbers are really high. It's everywhere. And then as predicted, the hospitalization rate is creeping up. It's still low. I mean, the hospitals can handle it, but it's starting to creep up. And then the next thing we'll see is the death rate will start to creep up as well. Now, are these going to be big, huge peaks like we've had with Delta and with the Omicron? I don't think so. I don't think anybody thinks so. But I mean, this is just the nature of the beast. The pandemic is not over. So what Dr. Fauci said the other day was that the explosive phase of the pandemic is over and that we are beginning to transition into this endemic stage, which is what we're talking about here. Lots of cases, a little creeping up with the hospitalization rate, and this may be a little roller coaster, but it'll be a small roller coaster, a kiddie roller coaster, hopefully. But all this depends on, if we're just going to throw in the towel on mitigations, continue with, anti-masking policy in some states and on airplanes. And that's another thing that may get turned around right away if that appeals court ruling goes into effect. We'll see. Internationally, though, you have to wear a mask if you're outside. Once you're outside of the United States, in a lot of countries where you're flying into, even though you don't have to wear the mask on the airplane, you may have to wear it when you get off the airplane. Otherwise, they're not going to let you off. So we'll see. So anyway, this is what's happening. It's a pandemic and not gone.
Yeah, and this ties directly into our first headline, which is vaccine for young children is delayed by incomplete data, says the FDA. What effect could this have on the sixth wave that you just said?
Well, the kids are highly susceptible to getting this. They tend not to get too serious a disease. However, more kids die from COVID than flu now. But there's right now at Children's Hospital, I think there's only one patient in the hospital with COVID. I heard that yesterday. Wow. So, the cases are down. That's great. But, if we're going to really get on top of this whole thing, we've got to vaccinate as many people as possible, and lower their risk of getting infection and lower their risk of getting seriously ill.
Right, absolutely. And now for our second big headline and pretty depressing landmark, more than half of Americans have been infected with the coronavirus at least once, the CDC is now saying. What can you tell us about this? 60% of Americans have had COVID since March of 2020.
Yeah, these are these serologic sentinel studies that have been done. This has been done for a lot of diseases in the past, HIV in particular, but other diseases as well. And it looks like 60% of Americans have already had COVID at least once. And of kids, it's 75% have had COVID at least one time. And this is real COVID, not antibodies from having a vaccine. So it's high. But one of the unfortunate features of this disease and of the vaccines is that the protective immunity does not last very long. It lasts months. This is great. And the cellular immunity or the T cell immunity may last even much longer. So preventing severe disease may be more important here. And that's great, but it's not good enough to stop the pandemic. That's the unfortunate thing. And that's just something we have to live with. And so vaccines are just one part of the solution. So it's vaccines, treatment like Paxlovid, and mitigations when necessary.
Right, absolutely. Now for our third big headline. The White House is pushing to increase use of Pfizer's COVID treatment, Paxlovid. What can you tell us about Paxlovid? It's going to be widely distributed among pharmacies, clinics, hospitals, etc.
Yeah, well, Paxlovid works great. And it doesn't matter whether you're vaccinated or not vaccinated. It's got a 90% efficacy rate of keeping people out of the hospital and therefore from dying. Doesn't matter about the vaccine at all. So this is great. So how come more people aren't taking it? 500,000 courses of the treatment have been given to patients, and the weekly prescriptions are increasing, but they're not increasing according to the numbers of the number of cases that are out there. So it's getting the drug to the right patient. Part of the problem is that you need to start the treatment within 5 days of your first symptom, or if you have no symptoms, the day of your first positive test. So you've got 5 days to start, and the earlier, the better. So that's difficult when the drug is, we don't know where the drugs are located. There's websites that can help you, but for a lot of people, they cannot navigate that website system and then tracking a pharmacy down, getting a doctor to put the order in. All that has to happen. The doctors really haven't been trained. Many of the general practitioners and primary care providers, some of them, will tell a patient, well, you don't need it, even though a person actually qualifies to take it. There's no reason why everybody who's infected shouldn't take that. One of the reasons is that it's not approved for everybody at this particular point is because they couldn't get, a lot of people don't get that sick. So they focused on just the high-risk people to study it. It doesn't mean it doesn't work in people who don't have underlying disease, but they would have to do a study with like 10,000 patients to show a benefit. So that's a little complicated to swallow, but let's just put it this way: about 30% of people in the United States are eligible to take Paxlovid. Just being overweight, diabetes, any kind of heart disease, any kind of kidney disease, any kind of liver disease, any disease, anybody on steroids, anybody over 65. All these things come into play. You add them all up, it's about 30% of the entire population. So this has to be sorted out. In New York, they've done a very good job, New York City, and they contracted out a provider everything is centralized in one place in Lower Manhattan. They have telemedicine visits associated with it and everything. People can get the medicine. They can go there. They have a great subway system in New York. You can take the subway, you can go pick it up, or if you can't travel, they will deliver it within 24 hours to wherever you are in the city of New York. And I think throughout New York State, I think they have a kind of a system like that. So that's a really super system.
Yeah.
Our system here is a little looser in that you've got to go to this website and you've got to find where the drugs are and make sure it's up to date, call ahead, and it's a little bit cumbersome. There needs to be some streamlining put into this. And this is what the current administration is trying to assist states with.
Right, absolutely. Yeah. And now for some COVID questions. Dr. Murphy, a viewer inquired about guidelines when someone has had a close contact exposure. What are the updated guidelines, and can you tell us what to do if you're vaccinated versus unvaccinated?
Yeah, if you have a contact with somebody, so this happened to me yesterday. I got a question from a woman in her 60s who was at a yoga class, and the yoga instructor emailed them or something, or contacted everyone in the class, said, I came down with COVID like the next day. So this is a contact. But she's vaccinated and boosted. So a vaccinated, boosted person up to date on vaccines, they don't have to quarantine if they come in contact with somebody unless they get sick or they have a positive test. Now, this woman her husband is also in his 60s and recently had a myocardial infarction. He had a heart attack. So the husband is very high risk. She's high risk because of age, and he's high risk because of age and the cardiac condition. And so she said, oh, should I quarantine from him or whatever? So the answer actually, because they're all vaccinated, that you don't have to quarantine in that case. And she'd be the primary contact and he's the secondary contact. So the secondary contacts don't have to do the quarantine thing anyway. Now, if they were unvaccinated, it's a different story. Yeah, you got to quarantine. But that's basically the deal. And, quarantine is, wearing a tight-fitting mask for 10 days. It's really 10 days before you're really free from infecting other people in most cases. So it's a big break between vaccinated and unvaccinated people.
Absolutely. And now for our second big COVID question. Should we still be wearing masks inside even though the cases are not very high? What can you tell us about mask usage right now in the US?
Yeah, so the situation is very confusing because every state, and now every country and agencies and stuff have their own masking rules. But if you just keep the basics clear, masks work. Some masks work better than other masks. The N95 mask works the best, but it's hard to wear for a very long period of time because it's so tight. It's hard to breathe. The surgical mask works second best. It works better if everybody's wearing a mask versus just half the people wearing a mask. You'll cut the infection rate even more. That's why mask mandates are really important. Everybody's got to really be doing it to get the biggest effect out of it. So that's one thing. The other thing is, now, certain areas of the country have very low rates. Some have medium rates, some have high rates right now. So you have to put that into the equation with the effectiveness of the mask. And then the third thing you have to think about is yourself, the patient. You are the patient. Are you at high risk? If you're at high risk, there should be a very low bar for masking when you go into an indoor space or have to be in contact with people that are not wearing masks.
Right. And now for our third and last question. Do vaccines protect against long COVID? This is a hot topic right now. What can you tell us about long COVID, and should we be getting the vaccine?
Yeah, no, it's long COVID is a big problem. There's been multiple studies that show that long COVID is very common. The Kaiser Family Foundation data, which is a huge database of real patients followed in one system, it was 14% at 3 to 6 months are still having symptoms, but it's really kind of all over the place, but it's real. Now, looking at the amount of long COVID, which can be mental fog, weakness, kind of malaise, fatigue, coughing, it's debilitating. And there's been multiple studies looking at this. The studies are kind of all over the place and all over the world. And it's clear in a couple of the big ones, in the United Kingdom, for example, they analyzed 8 studies, and 6 of them found that the vaccinated people were less likely than the unvaccinated to develop symptoms. So that, is a pretty big summary of what's going on over there. And then the U.S. Veterans Health Administration, which is a huge healthcare provider in the United States, that's in one system with one medical record. They showed that the vaccinated people had only 13% less long COVID than the unvaccinated ones, but still it was a decrease of 13%. And then another study with 1.2 million people found that it was 50% lower. So the point is, pick your study. We're not even really sure how to diagnose long COVID, and but it's all in the direction that the vaccines not only prevent against severe disease, death, but also long COVID. So that is just reality with all these studies with literally millions of patients have been followed. So it does protect. And so it's just yet another reason why you want to be up to date with your vaccines. Have a mask handy in case you do need it. And if you do get infected and you're and you're eligible to take Paxlovid or some of the newer drugs that are coming out, you can take it. All that is in our toolbox right now to try to control the pandemic. And if you do all those things, you're going to be okay. And this will help transition us into this endemic stage of the disease.
Yeah, very well said. Thank you, Dr. Murphy. Those are all the questions for today.
Great. Have a good day.